Today's really exciting. So we're holding a community panel, which means that we've got members from our community to come in here at the Primary Health Network to help us work through a particular challenge. And we feel it's really important to actually go out to our community members and hear from them what's going to be important and what will help them be able to access primary health care. That then allows us to take the recommendations and the ideas that the panel has and directly put that into our proposal to the department for funding and hopefully be able to commission a service to improve that access for community in our region.
The benefit of a panel like this is we can go deep, we can ask the question, but also we're really getting an opportunity to hear from the community what the issue is and what are some solutions that works for the community members.
My understanding is the multicultural communities are not using the facilities that's available to them. The panel like this helps to better guide the community to use the facilities.
We've already started workshopping the different questions about the main topic, which is how can we improve access to health services in primary care for people from multicultural communities. With diversity of humans comes diversity of viewpoints, life experience, and that's all going to make a richer consultation. You're going to get more variance in the outcome.
I want to provide a unique lived experience of having different intersecting identities. That's being like a person of color, being a queer person, being someone who's Muslim as well, and also a young person, and how all those identities intersect and interact, and what my experience is when I'm using the healthcare system as well.
Well, the thing that surprised me most about the community panel is how friendly everyone's been, how communicative they are with each other, and how accepting the facilitators have been of everyone's different opinion.
Seeing that, there are ideas that I haven't personally had, but we've been able to work together and found significant things that we all share that we're all currently facing. And if I'm facing those issues, the community probably is as well.
The amount of effort that PHN has taken to collect all our information at the end of the day. I mean, so many ideas. It's really interesting how many ideas we've got, rich ideas, which are so collaborative. And we've come together as a community, although we're from different backgrounds, but it feels like a community workshop today where our voices are heard.
The network has been really helpful. I've really enjoyed hearing from them.
We are all on a similar page. We want to be heard, we want to respect different viewpoints, and we want to work together for a good outcome.